welcome to another episode of the Edmonds Mom's Room podcast. I am Dr. Allison Felt with Body Motion Physical Therapy, and today we have on someone who I know dearly and deeply and have serious appreciation for, so it's a serious pleasure to be interviewing her. And I also just want to mention, this is something we've never really done on the podcast before, and we help people through pregnancy, birth, and recovery, and even preconception. And so this is an aspect of like birth and pregnancy that we've never really dove into before. So without further ado, please welcome Christina Hughes from Big Fat Pregnancy. Thank you so much for being here.
Thank you for having me, Allison. It's my absolute pleasure to join you in this space today.
Yay! Okay, so this has been a long time coming, really. Christina and I go way back, and we're friends, and so this will be, you're going to hear us be relaxed, and really we're recording like a coffee date here today because we've talked about this many times, and I want to be able to bring this conversation to the birth space, to the mom space. There's so much stigma around being fat, or even like classifying yourself as fat, or being told that you're fat. And fat, man, in this world is so negative for a lot of people. And so you're kind of here to change the dialogue and change the standard. So I want to talk about what your business is about, and feel free to introduce yourself.
Yeah. Thanks again for having me. So, as Allison said, my name's Christina Hughes. I use she, her pronouns, and I am joining you today as a self-proclaimed fat woman who is very, very interested in the birth space. So, as Allison mentioned, I came to her as a client looking for some support in preconception, and really evolved into a friendship and a space of camaraderie, not to mention some serious help preparing, physically and also mentally to have a baby, something that had been really challenging for me to wrap my head around as a fat person. I had a lot of stigma and a lot of internal and external guilt around what it would look like to be a pregnant woman plus size. Y'all can't see me in this podcast, but I'm a 6'1" white woman who weighs about 300 pounds. I have a size 24 pant, and I'm fully ingrained in that plus size world. So yeah, I came to Dr. Allison, and through our time working together, she just really encouraged me to be the powerhouse birther that I could be, and not take my weight into consideration. And that, with a lot of other factors, master's education, some self-work, and some exploration into the fat activism and body positivity and HAES spaces, all kind of brought me to where I am today, which is working to hopefully empower women to find joy in their pregnancies. And when I say women, that's inclusive for me of all those who identify as women, birthing folks who identify as fat, and both birthing people who are just looking how to find joy during this time, pregnancy, postpartum, and the actual act of birthing. So that's why I'm here.
Oh, I love it. I want to cry. It speaks so closely to my heart. Obviously, I'm in this world and I get to speak with moms, and if I'm lucky enough to treat people, help women preconception, it's like magical, right? Like we went through that journey together. And so I hear
Definitely.
all the time, oh, my OB said I have to lose this amount of weight, or even just like, I think I need to drop 20 pounds before I can conceive. And I get caught in that as well, and we've talked about that before. It's hard not to be like, oh yeah, like, am I doing my baby and my body a disservice? Like, is my weight, am I not healthy enough at this weight?
Yeah.
So, I think that's self-talk for pretty much every mom out there, regardless of the size, body,
100%. Yeah, and I think that a lot of the issues that we face as fat pregnant women is that we've been so strongly told this narrative our whole lives that being fat is bad, being fat is unhealthy, instead of people taking people for what they are, individual cases, right? We're so much more than numbers on the scale. We're so much more than even numbers in tests, right? And finding, providers who believe that and who empower you to consider health from a multidimensional, intersectional place, right? All of your identities come together to make up your health: mind, body, spirit, soul, heart. Physical obviously is important, but that looks different to everybody. So yeah, first and foremost, it's untangling that story that we've told, that narrative that we've created in our heads, that we have to be a certain size or a certain number to birth well and to have a positive birth experience. We've talked about this. I was terrified that being fat would mean I would have complications. I would have gestational diabetes. I would have to have a C-section, that my birth would be surrounded with so much trauma, all because of the physical size of my body. And research really shows us that, the evidence around weight and health, they can often miscategorize people. They can be useful tools. I don't want to rule them out. And I think that they're just that. They're tools, right? They're not a category of, yes, you will succeed. No, you won't succeed. So, finding a provider, right, that respects you as a person and values you as an individual person and will take your stats and your version of what health means to you, was the number one thing that changed my experience, and the thing that I want really passionately to be able to help other women find.
Oh, I love that. And I have so many ways I want to go with this. But first, I want to say, you do talk about, or you have talked about with me at least, like, just because you're a certain weight doesn't mean you're going to have a certain health outcome. And can you speak to the research, which you just kind of said, but can you speak to the research about the provider bias a little bit?
Yeah.
Okay.
Yeah. So yeah, that's a great question. So I think, it's called different things. It's called provider bias. It's called weight stigma. It's called fat shaming, right? Well, however it shows up in the medical space, we usually call it weight stigma, which is, having a bias against someone, an internalized negative attitude usually about weight, that it increases all of these sorts of disorders. So yes, it can be connected to those sorts of, disorders and health problems in ways, but we're looking at kind of how the weight stigma really affects the way we provide care. So this can boil down to something as simple as not having chairs that are big enough for fat people to sit in, not having blood pressure cuffs that fit around women. And it can escalate up, right? It can escalate into not pursuing treatment options because someone is fat, or prescribing or recommending treatments only because a person is fat. And so it really shows up in a lot of different ways. The Association for Size, Diversity, and Health has done a lot of research on this. The University of Connecticut has a food policy and obesity weight bias prevention kit that doctors can use. And a lot of the resources that I've found have come from really looking at HAES providers. So finding HAES providers that are out there, seeing what they're doing. And to be honest, there's not a ton of HAES specific providers that are registered, quote unquote, registered as providers.
Why don't you tell us what HAES is?
Oh, yeah, sure. Thank you.
Yeah.
So HAES is this idea of, it stands for health at every size. So it's a weight inclusive approach to medical care that can be helpful when working with patients who either have trauma in their history around weight, or you just want to have a very, conscious, aware way to treat all people who might be overweight. So it's not without its own issues. It has some criticism, but I think the general principles of weight inclusivity, health enhancement, respectful care, and eating for well-being are really kind of general principles that can be applied to all spaces.
Interesting. Thank you.
Yeah.
I want to break down in the research. I'm going to dummy this up. So
yeah, go for it.
Because you're so well educated on this, and I want to bring it to the
masses.
How do I say this? I guess the masses, or even just people that maybe they feel they're overweight but don't identify as a fat person.
Yeah, you bet.
And so one of the things that I think really spoke to me when you've talked about this before is is this idea that the bias is not, the research shows that like, okay, being overweight or having a certain BMI, which we all know is like BS anyways, right? The BMI is not a definer of health, and has definitely not been shown to define what health is.
Yeah.
And so being that certain way doesn't necessarily mean that you're going to have a certain outcome. But those providers that have biases, that's actually more correlated with those negative outcomes. Is that right? And how can I say that with more? Things that stuck with me, and I want you to say that in a more luxurious way.
I'll try. So the summary of evidence right now that supports health at every size, that supports the kind of that philosophy, is that higher weight is correlated with certain health conditions, yes, but it's not causal. So it doesn't mean that because you are heavy, you will have X disease or you will have X problem birthing. But what happens is when our bias enters the space, providers, people, we are conditioned to believe that relationship is causal. And so we see a fat person who is coming into the birth space and we say, oh, that fat person needs to be tested more because they are probably going to have gestational diabetes, right? We're putting that outcome on the patient. So what is proven right now around the stigma piece of it is that weight stigma leads to weight cycling, which is the yo-yo dieting. It's probably the more common term that people are familiar with. And this type of eating has been shown to, or this type of dieting has been shown to increase mortality risk, to increase hypertension, to increase diabetes. So it's the shame around not seeking care, and it's the weight cycling that comes from being shamed to believe that being fat or being overweight or being obese is bad and kind of the worst thing we can be in society, right? That the general messaging is that fat is the worst thing that you can be. And those messages become so deeply ingrained in ourselves, and it triggers negative thought. It triggers that weight cycling. It triggers not seeking care, which keeps us from, having the outcomes and obviously the treatment that we want. So the actual experiences that people are having in doctors' offices are keeping them from coming back. They're keeping them from getting the treatment that they need for their actual symptoms. And they're putting, for lack of a better term, they're putting an outcome onto a birthing person because of their weight.
Yeah. Wow. That's powerful. Yeah. And I think once you know that, it allows, hopefully, and what I really want this podcast to bring is allows women to be more confident in the size that they are, to feel more powerful and able to birth how they want to birth, and not think, not be prescribed a certain negative outcome or a C-section or a pelvic organ prolapse or a whatever, the list goes on. But thank you for sharing that.
Yeah, you're welcome.
Tell me a little bit about, I guess I want to know about your vision. I want to know what's your company about, and I want to know where you're going with this.
Yeah, that's a great question. So, for me, through my experience with birthing, I knew from the very beginning that I was afraid of giving birth. I was afraid of what that looked like. I was afraid of the medical system. I was afraid I physically and mentally couldn't do it. And so I focused very diligently on creating a care team that aligned with my beliefs. Finding a midwife that believed that, anecdotally from all of the births she's attended and just her core beliefs, believed that fat women are more than capable of having amazing, empowering births. She told me one time that fat women are actually usually have an easier time because they're stronger, because they carry around more weight every day. So they're a little bit more prepped, right? So it's just something that I never thought about that from that angle. So something as small as that, right, gave me hope. So finding providers that really believed what I believed, who were willing to support me and not shame me in my fat body and the body I was showing up with in that exact moment. And I needed to have people around me who also believed that. So I to understand what I believed about birth and what I believed about myself. So I did a lot of self-work to figure out where this journey of birth was taking me, how to prepare. And I did a lot of affirmation seeking. So positive thinking, finding things that made me feel like I was in control, even though that's a fallacy. We're never in control with birth, I don't think. But, just putting me in the right space, right? And I did all of this work to prep to hopefully have a positive birth. And I want to pause for a minute and say that my definition of positive birth is one in which you are cared for and respected and safe, and you ultimately have, hopefully a happy baby, happy, healthy baby and mom, or birthing person. But that doesn't mean it's not without things that happen. It means that you were so cared for and so respected in the situation that even if an intervention occurred, and even if that intervention was potentially traumatic, that you can still look back and have a positive recollection of your experience. So all that to say, I moved through this whole experience trying to find that outcome, trying to find a space where I could look back the next day after having this baby and say, yes, that was a positive experience. As a fat person, I enjoyed that experience. Not to say it wasn't hard and that there were times that I was like, I can't do this. But it was a joyful experience for me. And I succeeded. I had a beautiful home birth that has made me feel stronger than I've ever felt in my entire life. I look at my birth experience of saying, it really empowered me to say, what's next? Like, if I can do that, what can't I do, right? And I want more women to be able to come out of their birth experience with that vibe. So long story short, too late for that. That's what my business is going to be about. So Big Fat Pregnancy is a space to help women on that journey. I was very motivated and I knew what I wanted out of my birth, and I had to fight every step of the way in order to do so. I want to make that fight easier for other women. I want, and birthing people. I use women, and again, I think I've said this, but I use women because it's a common term, and I recognize that that can be exclusionary, and that's not my goal. I recognize that anyone who identifies as a woman or a birthing person is what I'm talking about. I want to help people, birthing people, folks who are going through this journey, find joy and do it in a way that's easier than what I had to do it. And I think it's possible. I think it's so possible. And I want to be the person who walks alongside, birthing folks in that journey.
Cool. Thank you for sharing that. That's magical and beautiful. And it brings me back to your whole birth prep and pregnancy and labor and everything about it. So I just love it. And let's tell the listeners you have a beautiful baby.
I do. Yes. My beautiful baby girl is now 19 months old. She's a toddler. Her name is Remy, and she came into this world with a lot of determination by her mama. And I want to make sure that the world that if she chooses to birth, is better for her, is better for others. We have a lot of issues in the birth space. So I think finding joy is one of the ways that I can help women through this. And as a, birth nerd and a fat activist and someone who is, hoping to be deeply involved in this space for a long time, I think there's a lot of other work that needs to be done around, outcomes and we can't just think happy thoughts and know that it'll be okay. So not to minimize anyone's experience with, trauma or the racism that exists within our birth space. But that's just one of the ways that I know I can focus and I know I can help women, in an impactful way.
Cool. Do you mind diving deeper into what this journey looks like when you're alongside a client and kind of what that looks like?
You bet. So I am kind of just getting this started. So my Instagram is up and running. My website is coming. And so far the work that I've done has been with, fat birthing folks who have come to me either by just, happenstance sharing my personal story, to do mostly right now it's one-on-one work. So it's, doing a lot of probing into, how are you showing up in this space right now? Basically, how are you showing up? What are your fears? What are your hopes? What are your dreams? And how do we get you there? How do we dissect and recreate the narratives in our heads, the care teams that we're looking to have how do we make decisions, when everything that we've been taught about being fat and being women can feel pretty demoralizing in that stage of being pregnant, and recognizing, right? And a lot of times in those first 12 weeks, you can't tell anybody, or people choose not to tell people that they're pregnant that early on, right? So my hope is early pregnancy, I can be a voice and a sounding board and some of that early, when those early questions pop up in your head, that I can be there to say, okay, let's look at where that thought came from. Let's look at the different types of care providers that you have. If you are worried about sizism, and fat phobia and weight stigma showing up in your pregnancy, let's find a provider that is going to be, speak to your heart as well as, taking care of your body. And let's see what that looks like. Let's look at the different types of care, the different types of birth. Let's dispel some of the myths around safety, some of the interventions that, while at many times are necessary and life-saving, aren't needed for the majority of low risk pregnancies and births. So, and I think the other thing that's really important for me is that pregnancy, postpartum, birth, the whole pregnancy cycle, if you will, it's more than just preparing to birth a child, right? Like that is a big focus of our lives, physically, mentally, is preparing to actually birth a child in this experience. But it's also about preparing to, how do we live as parents afterwards? The fat phobia, the fat shaming doesn't stop just because you're no longer pregnant. Like it keeps happening as a fat mom, right? I've had people ask, are you going to get Remy tested for X? Are you going to get her? I've had people ask questions about her size. She's very tall. She's a very tall kid. Like I said, I'm 6'1". People are already shaming her about being tall. Oh, she's too big for her age. Oh, what are you feeding her? Oh, how could you, do X? How could you do Y, right? Like the fat shaming, the weight stigma, it does not stop just because the baby's no longer in your body. So, it's preparing for rewriting our narrative, like I said, at all stages. Pregnancy specifically is my, powerhouse, my focus, because I loved that experience so much. And I recognize that it's a full cycle. It's a full, if you will, from start to finish. No finish, actually.
Right. Oh, that's beautiful. Yeah. So, okay, I know that's your passion. Now let's take it to preconception. Started here at the beginning and we didn't really finish it. And I want to just go back to it.
Yeah.
So can you work with those moms in the 0 trimester phase?
Yes.
Like they're preconception, wanting to get pregnant, have the negative self-talk of like, I really do need to lose 20 pounds.
Yep.
And I'm talking I'm truly talking about independent of any size, because I think so many people have what I'm going to call disordered thoughts around weight and their own personal weight and their own personal views of themselves. And I'm not saying I'm free from that at all, but just from how can you help, and do you help in that stage of the game?
Yeah, definitely. So, I think the answer is yes. I would love to work with women birthing folks preconception, for sure. I have a lot of medical issues around my ovaries. I was premature myself, so I was born with a lot of just physical issues with my body as well. And combine that with being fat, I heard all my life, it's going to take so long for you to get pregnant. You're never going to get pregnant. You're probably going to have to do IVF. You have so much damage from these surgeries combined with being overweight and carrying most of your weight in your belly. It's going to be so hard for you. I mean, I've had an OB since I was OBGYN since I was 13 is when they kind of figured out all these issues started happening. And that's been the messaging I received since I was 13 years old. Right? And I got pregnant in a month.
I remember that.
And I had a super healthy pregnancy, by my definition of super healthy, my midwife's definition of super healthy. I birthed a, beautiful 8-pound baby girl who had, no complications, no health issues. So, in that specific example, right, it was all bull, right? They didn't know. They were guessing, but that preparing me for the worst damaged me. I mean, I really, really thought all my life I wanted to be a mom. And so, and all my life, I equated being a mom with, disappointment, because I thought it was never going to happen. And I thought because of my weight, I would have to, crash diet. I would have to, follow really strict regimens. I would have to resort to disordered, eating, right, in order to be small enough, good enough, worthy enough to birth a baby. And that simply, in my opinion, is not true. There are medical complications which make things harder for some women to have babies, and I think that infertility is, especially fat infertility, is a topic we need to pay attention to as well. I don't want to minimize anyone's experience with not being able to conceive. So yes, I would love to work with women with birthing folks who are thinking about, I can't have a baby because I'm too fat. I can't do X because I'm too fat.
Yeah.
Believe me, I have so many Instagram accounts I can share with you of fat women out there birthing like nobody's business, and being living proof that that's not true.
Yeah.
And providing a space that if for some reason it is medically true and that there is a connection, that we work through how to navigate those thoughts and those emotions that we tie so deeply to our worth, while still looking at advice from doctors and midwives and things that can move you forward in the process.
I think that's so great and so needed. And one of the things that speaks to me when you're speaking of this, and really how I think you'll truly make an impact on so many women, is I remember you coming to me preconception, and you, of course, your story, unfortunately, unlike many other people's stories, their physical therapy journey maybe wasn't always positive, right? You're I've been to physical therapy, I've done this, but you researched, you knew, and I think that dialogue maybe made you kind of dive into the research even then. And you were really smart, thorough, diligent about kind of prepping your body for what this pregnancy was gonna look like.
Yeah.
And I think that tenacity to kind of figure it out for yourself is the value that you're gonna add for so many women that haven't. I remember asking you preconception, how did you know that physical therapy could help you preconception? How did you know to find me, and all that? And you were working with an exercise specialist who really helped women through preconception at that time. And I just found that so empowering, because women, I think, don't know and aren't ever taught that there's all this stuff that we can do for our body.
Yeah.
And I think you're even though it's negative, this self-talk and the even the verbal, what the OBs have ingrained in you, it was negative, but it also stimulated, there has to be more. So I'm going to prepare kind of dialogue within yourself. And that's what I think is amazing. And that's what I think people don't realize that they're, to seek out.
Yeah.
And even if it ends up being a medical fertility journey with IUI, IVF, and that whole realm, it doesn't always have to be that way. And there's a lot of research that's actually showing okay, if we can dive a little bit deeper into what's happening, maybe in the physical body, maybe it's through adhesions, maybe it's through, different scar tissue and whatnot. There's so much that can, I guess, affect preconception.
Yeah.
And I think that's where your advocacy, first off, could save families, not to joke about this, but you could save families $50,000 of and the disappointment and the, I think there's just so much work that is needed and beneficial. And I know I'm preaching to the choir, but I just, I think that it's cool that you figured it out by yourself. And I hope that no one ever has to figure it out by themselves again. And that's really where I think your work comes in.
Yeah, I think, I call it a, kind of cosmic alignment, or the universe was really begging for me to, move in this direction. I actually got pregnant, as you know, while I was in grad school. And my grad school work is my education, my master's degree is focusing on adult education and educating adults. And so I'd always kind of had a passion for the birth world. So I was dabbling and learning more about, the birth space and birth professions, about doulas, about, physical therapy, about midwives. And then I got pregnant. And so it was like the researcher inside of me was like, I must know everything. So, I think it was really serendipitous that sparked my journey to finding out more and having access to so many medical journals and texts while I was in grad school, and journals of, education and Dona International, right? All these resources I was able to dive into. And I learned so much that way. And that's a privilege, right? That's a resource that, people are probably not going to have while they're birthing, while they're on their pregnancy journey. So yeah, I want to work with families to bring that, that type of knowledge and exploration and, help them do the research, help, do some of the research for them, share the research that I've uncovered. Because I think I don't know much about, what you're talking about from a physical standpoint. Obviously, as a physical therapist, that's your area of expertise. And I think that, a combination of someone who knows that there's more to learn in all of these fields, right? That's what prompted me to come to you, was like, I'm not an expert in this field, no matter how many journals I read. So let's go get some physical therapy. And that's what I want to really explore with clients in that preconception space is, what is going on? What resources do I need? What professionals can we get connected with, to hopefully change outcomes and explore the future.
Right. And it's so not just physical. That was my example because I am a physical therapist, but the example is just like, it's so connected, mind, body, soul, all of it. And anything, having that power is what I think is truly, and I provide that through physical care, but you'll provide that through more of like a spiritual journey and, I don't know, what's the word? Mind, exploration and confidence. So that's how you'll kind of, I guess, which becomes then physical. So it's just all connected. And I think there's so much for, I'm so excited about the work you're doing, obviously. And I'm really grateful that you came on to share.
Yeah. And I mean, on that note, like everything that I've read, shows a really growing body of evidence that supports the positive correlation between mind health and body health. And that, our somatic experience, which means, what we're feeling in our physical body, it remembers joy, it remembers happiness, it remembers trauma. So when you're, tackling things from that side of the fence, and then someone like me is tackling it from the other side, right? Like that's a powerhouse duo. So it's one of the reasons why I think we jive so well, is that we do see it from different angles. And I think the right way. I think you need all angles to be able to help with that journey and to be able to have a well-rounded experience, is my opinion.
Yeah, absolutely. Is there anything that you want to leave our listeners with what do you want to leave our listeners with?
That fat joy is possible, and it's warranted, and you deserve it, and that it's possible all the time. And it's especially possible during pregnancy. And if that's something that you want to explore and learn more about and go on this journey with me, I would love for you to join me at Big Fat Pregnancy on Instagram. And, I'm still learning, and every day I uncover something that says, yes, like do this. This is the right path. And I want to be a part of people's journey. That's my takeaway.
I love it. Thank you so much for sharing. And I'm really excited to see what's to come for you and what the next few years are going to bring. Because I think I don't know anyone doing this kind of work. I know you've mentioned a couple other Instagram channels, but like I don't know of this here, at least in the Seattle area. And I'm super grateful that you're diving into this. So thank you.
Yeah, I'm so happy to be here. And, from your client to your friend to, a partner in the field, this, is honestly a dream come true to be able to talk to you in this space and to share, my message with, others out there who might be in a place that I was a couple years ago. So I'm looking forward to potentially having the opportunity to work with birthing folks in that space. So thank you. It was truly a pleasure.
Oh, thank you so much, Christina.
The Edmonds Mom's Room podcast is brought to you by Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, confident, and healthy lives.